Assalamu alaikum and welcome to Learn with Laraib. Today we will be discussing thalamus. In our previous video, we discussed that diencephalon matures into thalamus, epithalamus, and subthalamus. This was discussed in basal ganglia, and hypothalamus was discussed in the last video. Also, before starting the video, I would like to mention that I said that GnRH is released from the preoptic nucleus, which is correct. I would like to add that this is also released from the arcuate nucleus present over here in the hypothalamus. So the FCPS option often says arcuate nucleus only. It does not mention the preoptic nucleus. So do not get confused. If you see GnRH release and arcuate nucleus from hypothalamus, that will be the correct answer. Okay, so now coming to thalamus. Thalamus is a major relay for all the ascending sensory information except olfaction. On this note, please remember that the olfactory area is present at the temporal gyrus and the olfactory cortex is at the inferior temporal lobe. All right, now for the thalamus, it has certain nuclei. Starting off with the anterior nucleus, denoted as AN, it will receive its input from the mammalian body and it will give off the output to the cingulate gyrus. Now, these are a part of limbic system we will be doing in other videos, and it is associated with emotion. Now coming on to the MedioDorsal Nucleus, it is involved with the limbic system. It receives its input from amygdala, prefrontal cortex, and temporal lobe, and it relays the information to the cingulate gyrus. And this one is involved in memory. Then we have the pulvinar nucleus, which is not a very high yield part and is not as important. We have the ventral lateral nucleus and the ventral medial nucleus. Both of these are involved in sensory relay. VPL will receive its input from the body and the limbs via the dorsal and spinothalamic pathway. The sensory input will travel to the VPL and it will be relayed to the somatosensory cortex. The VPM will receive its sensory information from the face via the trigeminal nerve as well as the gustatory nerve. So the sensory and the taste sensation will be relayed via VPM to the primary somatosensory cortex. VPL is involved with the body via dorsal and spinal tract. VPM is involved with the face via trigeminal and gustatory pathway. Now moving on to ventral anterior and ventral lateral nuclei. Both of these are motor nuclei. Both will receive their input from basal ganglia and the cerebellum. So the corrected and balanced input from the cerebellum and basal ganglia will be relayed from the thalamus towards the motor cortex. I hope you remember the function of basal ganglia and cerebellum as we discussed in our previous video, or you can watch my video on that for it. All right, so this was about the thalamus, and there is another part of thalamus, the medial geniculate body. This is very important and comes in a lot of MCQs. So the medial geniculate body gets the supply from superior olivary and the inferior collicus of tectum. This is a part of midbrain and it gets the auditory supply and is relayed then to the primary auditory cortex. Similarly, the lateral geniculate body receives its input from the optic tract or the cranial nerve 2, and then this will be a visual sense relayed through lateral geniculate body to the primary visual cortex. So if we see, thalamus is actually relaying all senses except olfaction, and this is a very important MCQ. So to summarize, the memory and emotion relay to the limbic system is via the anterior nucleus and the MedioDorsal nucleus. The sensory supply from the dorsal column plus spinothalamic to the primary somatosensory cortex is via ventral lateral nucleus, and the sensory supply from the trigeminal and gustatory to the primary somatosensory is via ventral medial. The motor supply from the cerebellum and basal ganglia to the cortex is via the ventral lateral and ventral anterior nucleus. The auditory relay to the auditory cortex is via the medial geniculate body. Remember it with the mnemonic music. We listen to the music through our ears. So medial geniculate body for the auditory cortex. For the visual cortex, the optic nerve is through the lateral geniculate body. So this was all about the structure of thalamus. Now I would like to tell you a very important condition associated with thalamus. Thalamic pain syndrome This is again an important MCQ. So, what is thalamic pain syndrome? Whenever there is hemorrhage of thalamus, there is pooling of blood and destruction of the nerve fibers, which causes overfiring. As we see that thalamus is involved in sensory relay due to overfiring of the sensory or the surviving thalamic neurons after the destruction, hyperesthesia occurs in our body. Hyperesthesia means that all the senses are heightened. So, for example, in vampires. So, hyperesthesia means that person feels a lot even on a normal stimuli. And this happens in thalamic pain syndrome or due to thalamic hemorrhage. What a person experiences in a thalamic pain syndrome, what will be the signs and symptoms of it. Initially, the person will present with hemisensory loss due to destruction of neurons, and later the person will develop hyperesthesia due to overfiring. So a scenario often comes that the patient develops sensory loss over the left side of the body, and after a few days, his behavior for pain has changed and he becomes angry after touching. So that means he is feeling a lot of pain even at a normal stimulus, and this raises a suspicion of thalamic pain syndrome. This is a very important clinical associated with thalamus. So I hope you were able to understand today's video. If you have any other questions, you can always comment. Please don't forget to subscribe the channel. Thank you.